Michael Pizzimenti. He is with the Health Quest Physical Therapy. Great to have you with us, Michael.
Great to be here.
So I know the coach just mentioned you as well. Can you tell us a little bit about a Health Quest Physical Therapy and what you do for some of these athletes?
Yeah, so we're private practice outpatient orthopedic clinic located at just north of Lone Pine and Orchard Lake Road. So right down the road, it's a stone's throw away from West Bloomfield High School. So moving out here 5 years ago, I established a relationship with their athletic trainer, Amy. And then I met Coach Bell through football season. And since then, I've kind of just been assisting Amy with the medical duties on the sideline, helping the athletes rehab injuries and get them back on the field. And not only now football, but through basketball, baseball, track, volleyball, all the sports.
So not only related to some of the sports injuries and the athletes, but your overall practice. How has things changed for you and members of your team during this pandemic?
Well, I mean, tremendously. So, come March, when everything started to really hit the fan, it seemed to be like every week, we were changing things up 2 to 3 times. CDC was coming out with different guidelines, and we were just trying to keep up with all the changes. We stayed open. Well, I stayed open. I personally stayed and treated just a handful of patients, post-operative patients and people that needed PT through the early stages. And slowly we started to build back up in the summer. So it's been a lot of safety procedures.
And like you said, the CDC and the guidelines have been changing. It's hard to keep up with. But a lot of people, maybe if they haven't been through physical therapy, they may not realize that physical therapy is a very important part of the healing process. And if you don't keep up with your physical therapy, it can sideline your recovery as well.
Well, for sure. One of the things that we saw a lot of people in the summer and the fall for were people that stopped going to the gym. They were sedentary. They were working from home where they weren't at an office. They were working at their kitchen table on the couch. And then they started coming to us because they stopped being active and they started to change the way that they moved or sat, stood, whatever it is. So we saw a lot of people with low back pain, neck pain, shoulder pain that developed because they were inactive. So physical therapy kind of set them on the right track again. And then we gave them at least as much as we could, even though the gyms were very limited this year, as you know.
That's a good a point that I didn't even think of before this interview. And we've had, several physical therapists on the show and they haven't brought that up. And with that, have you guys been able to utilize telemedicine we're seeing in some of the other practices as well?
Yes, we're doing telemedicine, whether it's just discussing their current status, updating their home exercise program, getting them any kind of information we can, sending them videos from what we can. At least they can help optimize what they can do on their own. Physical therapy, it's tough to some degree because a lot of it has to do with the hands-on manual therapy, one-on-one time with a therapist. So it is tough to optimize completely. So we have actually done telehealth, a hybrid for a lot of patients, where we've done telehealth, once a week or so, and they come on in another time in the week, just to minimize exposure, but also to still get that hands-on that they need. And people do find a lot of benefit from that hybrid type approach.
How do people know if they're having issues and they're one of those people that maybe you mentioned that they're not going to the gym right now due to the restrictions and they're starting to feel pain? When do they know to go to a physical therapist versus going to a doctor or even a chiropractor?
So we do free pain assessments. So if you're having any kind of pain, you can come in, no obligation whatsoever. It's a 15 to 25 minute consultation. It's basically a chat, maybe a quick screen. And then from there, we kind of point them in the right direction of where they should go, whether PT is indicated, if they should go see their primary care physician, if they need to go see a specialist. There's some kind of conversation that we want to be a gatekeeper and a liaison for them in the rehab process. We do help tremendously, obviously, with the pain, but also correcting what's causing the pain is a big problem. So posturing, sitting at home, maybe educating them for a better setup at home if they might not have the opportunity to go into the office anymore, and how to strengthen certain muscles, to postural muscles too, so they don't fall into the bad habits that they've fallen into in 2020.
Right, now's a good time to do that 30-day plank challenge.
Yeah, absolutely. There's no shortage of core strengthening exercises and the importance of those.
One thing we've heard a lot about during this pandemic when they did have the gyms closed was the importance of physical activity. for not only our physical well-being, but also our mental well-being. What are your thoughts around for gyms being able to remain open?
So, I mean, there's a lot of mixed feelings with this topic, right? It's a hot topic, whether things should be open or things should be closed. I know personally from what we're doing at our facility, keeping people, separate, social distancing, masked up. We're washing everything down. We've spent more money on cleaning supplies than I think we're going to spend in the next decade. But things are safe at our clinic, and I personally know some gym owners that have gone out of their way, and their gym setups are very, very safe. And I've had people from the gyms comment on how safe they do feel from working out at the gym. And I can't tell you the amount of people that have come into me and they're happy just to be moving around and being worked on and feeling that they're making some kind of recovery or progress. People being cooped up at home, it is depressing. And there is a large mental and emotional aspect to it too, not just physical.
What advice do you have for people who are stuck at home right now? I feel like I need a yoga class right now. Like your body starts to feel tense.
For
What
sure.
advice do you give to people who are stuck at home right now, who still maybe aren't comfortable going out?
Give HealthQuest a call. Give your gyms a call. See if they're doing some kind of telehealth or Zoom workout where you can actually, I know I go to a CrossFit gym in Bloomfield Hills, and I know that they're doing a lot of Zoom workouts. So they still have some kind of camaraderie where the same people are going into those classes and working out together from home, and they're doing as the best that they can with the equipment provided to them at home. I would just say get up and move. And I know that's hard in the winter, right? Get up and move around your house if able to. But that's part of the things that we do is educate people and educate them on, hey, you know what, things around the house that you might not have thought of, and somehow giving them some kind of home workout, even though they think they have no equipment at home, we might be able to, finagle something at home to create some kind of program for them. And then set reminders in your phone every hour, once a day, whatever it is, get up and do something.
That's really good advice right there, and it takes nothing and it costs nothing as well. Michael Pizzimenti with us. He's the director and owner for HealthQuest Physical Therapy. Lessons learned for you and your team during this pandemic that you think are going to last post-pandemic if we ever get there.
People are good. I've learned that this year. I've always thought I've had a great team. With all the struggles this year, I have learned that I have a phenomenal team. They were able to answer the call at any time. There was no questions. It was just that everybody was yes to everything. We got you. I got their back. They got my back. Patients coming on in too. People are just so appreciative of everything. And especially this year, their appreciation does show probably even more than in years past. I think in 2020, if it taught us anything, we don't take things for granted, because they can quickly be put on hold, taken away, limited. So this year, we're just much more appreciative of everybody and everything. And we have learned to really be creative in our physical therapy approach, because yes, we did have to reduce certain days and we had to limit volume in the clinic at any specific time. So yes, we do run a more limited volume at any specific time in the clinic, but I've learned how to schedule better, and we've learned how to create different exercise programs where we can separate people a little bit more. And then the whole telehealth was a new thing that I think all physical therapy, we didn't really do telehealth before. So learning how to educate people over the phone or, via Zoom, there was a learning curve there early in the year last year, but that we've kind of well oiled now, and people are appreciative of anything that we can do. So being more creative was a big thing that we learned in 2020.
I kind of think about if this conversation would be happening prior to the pandemic, saying, hey, we're going to do our physical therapy via telehealth and Zoom. People would be like, no, that's not going to work. There would be so much pushback. But just as you said, we've all learned not to take things for granted. And hopefully we all come out a little bit stronger and a little bit better at the end of this.
Yes, I think so. They're ready for it for sure. But moving forward too, again, we learned how to manage the clinic, I think, even a little bit better than we were. And I realize the strengths of my team now are even more so than I thought. So there was a lot of realization this year. So moving forward, there's a lot of lessons to be learned from this.
Hey, Michael, just another minute or so with you here on the MegaCast before we let you go. Anything that maybe you want to mention that I didn't ask?
You know, people's fear this year is at an all-time high. 2020 and even now in 2021, obviously, and just know that there are options out there for you, whether it is a gym or it is, you know, physical therapy. We've had a lot of positive feedback from patients with they came on in very nervous, and it wasn't too quickly after that where they were really confident in everything that we were doing. Private room practice, whatever it may be, we're very accommodating. So
Well, that's great. And we've all learned that our health is the number one priority throughout this pandemic. Hey,
absolutely.
quickly before we say goodbye, how can people find out or connect with your team?
So website HQ as in Health Quest, hqpt.com is our website. My the clinic number that I'm located at is 248-788-6100. And we have wide hours 6 a.m. to 8 p.m. and we're open Saturday mornings as well. Call anytime. My front office is awesome and they can lead you in the right direction.
Well, it's been great having you with us here on the MegaCast, and we wish you continued success in 2021.
Thank you so much.